Herbal medicine for mental health. There are so many wonderful herbal medicines that we can use to bring about balance for our mental health. This includes mood, sleep, helping for insomnia, decreasing depression, improving energy, and I'm going to walk you through what you need to know to begin your work in herbal medicine, working both for yourself and your own health, but also for that of your clients. The ethics of herbal medicine practice, that's where we're going to begin. If you recall, we explored the ethics of nutritional medicine practice, and so considering what we're able to do, both in terms of scope of practice, competency, and what the laws are in the United States are going to be very important as you decide how to integrate herbal medicine into your clinical practice for mental health. There's currently no licensing or certification for the practice of herbal medicine for mental health or any other kind of health. That means that you are free to learn, study, make recommendations, and support your clients. Now, it's very important that to do so, you're competent to do that as well. The state will not stop you from doing this. You still want to explore what the scope of practice and what your particular practice guidelines are in terms of your licensure, in terms of your field of practice and your discipline. But in terms of state laws, there is nothing prohibiting you from recommending herbal teas, herbal tinctures, capsules to help your client come into balance. And consider that just as we explored in culinary medicine and nutritional medicine for mental health, you may choose not to actually make the specific recommendations, but just the act of knowing what's out there, what the science is, what the evidence is, and what the options are for your clients when they come to you. That is going to be an important aspect of anyone's practice in making appropriate referrals. For example, I always serve an herbal tea in my office waiting room, and it's an herbal tea that I also provide written evidence for, a little recipe, and then a little bit of the science. Why is chamomile tea good to help you relax? Or why is rhodiola a good substitute for coffee? And so you may begin just with educating your clients about some alternatives. Let's say they're coming off caffeine addiction and they want a little pick-me-up. What's a good alternative for that? Or you may decide to go full force into the practice of herbal medicine for mental health. And so today I'm going to share with you what is known and a little bit of what's not known about how to use herbs for mental health. Now, there are a number of people who practice herbal medicine as part of their licensure. And the practice of herbal medicine is, as I say, it's open to practice to everyone. But there are some people who are trained, such as acupuncturists may go through a certification program that allows them to practice complex formulations of putting together herbal remedies for their clients. So you may find a licensed acupuncturist or a doctor of Oriental medicine, it's often called, or a diplomat in Chinese herbology. You'll also find well-trained herbalists working for the American Herbalist Guild or registered with them under the title Registered Herbalist. Now, that does not mean that people other than those individuals don't know about herbs. Many people know a lot about herbs. And this brings me to the concept of health freedom legislation, because there's a big movement in the United States to regulate the practice of what we call complementary or alternative medicine. And what's important to know is that in order to practice health freedom, there are laws and legislative initiatives in a variety of states that suggest that as long as you are not prescribing or undergoing or undertaking the role of a licensed medical provider, that you can share knowledge about different information that will benefit your client's health. And so I encourage you to look up health freedom legislation in your own state or also countrywide to explore this further. And the definition that these legislative laws are exploring includes the freedom of the public to choose and have access to a variety of practitioners and modalities of healthcare. It provides a range of legal protections for herbalists and other unlicensed practitioners from violations of state-level medical practice acts. Now, generally, the advice is to include in your written disclosures and to create consent statements for your clients, making it clear that you are not a licensed physician. And these laws do not permit unlicensed practitioners to engage in practices specific to licensed physicians, such as surgery or prescribing of medications. And so, as you consider exploring your own entry into this field or expansion of your work, consider once again your licensure, your certifications, your competency to practice and to make recommendations and to educate your clients about options, and then your collaborative opportunities with specialists in the fields. Okay, how to integrate herbal medicine into your mental health practice. Most major university teaching hospitals now incorporate herbal medicine into mental health, physical health, pain care, sleep, and cancer care. Pharmaceutical grade herbs are available and are being used in clinical settings nationwide and worldwide. When you're looking for herbal medicine products, look for products that are formulated according to what is called the U.S. Pharmacopoeia. This is a standard pharmaceutical resource that has built up an empirical state of knowledge on what herbs work and what the formula are for putting these herbs together into substances that have physical and mental health effects. I also ask the question, are these herbs also wildcrafted? And this brings us back to the question of who practices and who gets to practice. Now, this is an ongoing area of controversy, not just in the area of herbal medicine, but as we'll look at other forms of practice, such as massage and healing touch therapies. So right now, there's a lot of controversy about becoming a registered herbalist and going through a certified training program in order to be able to practice and having some kind of certification. However, many people who practice in the field, who, let's say, are from traditional communities, indigenous communities, where their knowledge has built up over millennia and has been passed on through oral tradition, often say, I already have this knowledge and I'm familiar with my knowledge base. I don't need a certification body telling me that I know what I'm talking about. And we see this as a natural tension as we move towards certification and licensure of knowledge in this field. At the same time, there remain a number of what we call traditional herbalists, just like there remain traditional naturopaths, or traditional bodywork practitioners. So just keep this in mind as you explore your own work in this field, that this is a natural tension that exists that will be continuing for quite some time. The other thing that's very important to understand when you're accessing herbal medicine, whether you're wildcrafting it yourself, whether you're accessing it through wildcraft, or whether you're obtaining it from a pharmaceutical grade company, and I'll share with you some of those wonderful resources, is to consider adulteration. What we're finding now is that many herbal medicines are coming in from all over the globe, and there's a fair amount of adulteration, particularly from the Chinese market. And so it's very important, just like when accessing food as medicine, to keep in mind that we need to maintain the purity of the sources. Otherwise, we're adding heavy metals or pesticides into a system that we're actually trying to help heal and recover. So what are some herbal medicine applications that I use in my practice? I use herbal medicine for people with post-traumatic stress disorder, PTSD, anxiety, depression, sleep, cognitive health and enhancement and cognitive decline prevention, and also physical health, in particular pain. I want you to look at this chart again. I've highlighted in purple the column named Botanicals. We have walked through this chart in other modules and will continue to explore the value of this chart. This is your go-to reference chart in all that you may practice as you explore the application of these remedies. Let me remind you that on the left-hand column, you see the neurotransmitter list: GABA, serotonin, dopamine, norepinephrine. We see amino acids and nutrients in the next column, but I've highlighted botanicals because these are the botanicals that are known to target these particular neurotransmitters. Now, let me take a step back and remind us that this isn't all, at least not even in a large part, about trying to get something out of our neurotransmitters. That's one aspect of whole health. And I don't mean to suggest that herbal medicine is all about replacing pharmaceuticals to get a boost or depress certain neurotransmitter function. Not at all. Herbs work as a whole entity, and I'll explore that concept in a little bit. While we appreciate active chemical substances in herbs and their real ability to affect our physical and mental health, that's not the only way herbs function. So let's remember that and keep that in balance as we explore the range of actions of how herbs work. So in this case, I'm sharing with you this chart that explores how, for example, valerian, hops, skullcap, green tea, and kava all have an active effect on the GABA neurotransmitter system. And what that means is that all of these herbs act to help us relax. They're anti-anxiety herbs or anxiolytics. They may help us sleep, they may be nervines, they calm down the nervous system. Their overall effect is one of relaxation. I'll dig into these herbs, pardon the pun, a little bit to share with you what we know about them and how to prepare them. St. John's wort, the next on the list, has a profound effect on the serotonergic system. And there's been a fair amount of research, evidence-based research, that looks at St. John's wort as having an efficacious effect on mild to moderate depression. Ginseng and fenugreek act on the dopamine receptors, so that suggests that they're going to be helpful with focus and attention. Again, St. John's wort, holy basil, and licorice, one of my favorite herbs that I'll share with you, have a very profound effect on norepinephrine. They're going to help manage stress in the body. And among my favorite herbs, sage, bacopa, melissa, ginkgo, and ashwagandha work on the acetylcholine receptors. Now, you remember from our discussion of nutritional medicine, the foods that act on acetylcholine, like eggs, liver, and salmon, these are our memory foods. These are our memory herbs. And that's why we're going to use these herbs not only to support our cognitive function, to support learning, but also to prevent cognitive decline as we age. Gotu kola, kava, and passion flower all work on the glutamate receptors, which in turn are anxiolytic. Now, gotu kola has been well studied for its use for the startle response in PTSD. So if you've got a patient with startle response, I suggest the use of gotu kola tea. We can go down for the endogenous opioids, papaver, somniferum, and then the cannabinoids, cannabis. So we've got internal cannabinoids, endogenous cannabinoids, and then plants such as cannabis and its sister plant, hops, which act on our endogenous opiates to bring about relaxation and oftentimes sleep. Let's talk about the different categories of herbal medicines for mental health. One important category is called adaptogens. You hear in the name adaptogen. These are plants that help us adapt to stress. This term was coined in Russia, where there's been tremendous research on herbal medicine. Indeed, there's been a great deal of research around the world on herbal medicine. So as you research, don't just stick to the US literature. Explore the European literature and Eastern literature, the literature of India. Very sophisticated bodies of knowledge. So what are adaptogens? Licorice root, and I don't mean the candy, I mean real licorice root, the kind that you can put a stick in your mouth and chew on it if you're overcoming a nicotine habit, or if you're about to cross the desert and you want to retain a little bit of fluid. But by and large, licorice is the preeminent herb known in Chinese herbal medicine, in Indian Ayurvedic medicine, and in American Indian medicine as well, for helping the body adapt to stress. Schizandra is another adaptogen, rhodiola, and I'll talk about rhodiola in a bit because it's my go-to herb for a little bit of an energy boost during the afternoon. It's a wonderful way to help reduce caffeine intake as well. Ginseng and ashwagandha, very well known for helping us adapt to stress. And if you remember, one of our major principles of recovery and mental health is reducing the hyperactive stress response, which can deplete the body of energy, leading to depression and inflammation, and leading then to self-medication and self-harming behaviors. And so if we can begin with an adaptogen, I have never met anyone who can't benefit from one adaptogenic herb. And as we move through this module, I'm going to show you how to put some herbs together in teas or in capsules, and how to dose them as well. Antidepressants. I've had so many clients come to me say, you know, I really don't want to take an antidepressant. Are there options? We've explored those options in culinary medicine and nutritional medicine. Let's look at them in herbal medicine as well. And the other reason it's important to understand these options is sometimes our clients self-medicate. I've had many clients come in with letting me know, oh, I just started taking St. John's wort. And I'll say, well, you're already taking another SSRI. Let's explore the effects of St. John's wort. And that's where my role as an educator comes in. Skullcap is a wonderful herb, and it's well known for its use for both depression and anxiety. So when I'm working with someone with anxious depression or irritable depression, skullcap is my go-to herb. And it's also helpful for sleep. Anxiolytics, kava and skullcap. Kava, I think, is the preeminent anxiolytic herb there is, and I'll go into that in more depth. Sedatives and nervines, what helps us relax? What's going to help tone down the hyperactive nervous system and help us sleep at night? Passion flower, hops, valerian, and cannabis. Now, cannabis is something that I'll explore later in this module, and how to understand the appropriate use of cannabis in the states where medical cannabis is legal, or where clients are asking about it. Note here, I don't have kava in the list as a sedative and a nervine. Kava can have anomalous reactions, meaning sometimes kava can stimulate. Yes, it's an anxiolytic, but it can stimulate you, and so that's why I don't recommend kava for sleep. I prefer to use kava during the day if someone's anxious, and then use a nervine like passion flower, hops, and valerian at night. Same goes with cannabis. You need to know the strain of cannabis that you're using. I personally prefer the cannabinoid-rich CBD variety for supporting sleep, rather than the psychoactive THC-rich strains. We'll talk about that in a little bit. It was really hard narrowing down the most important herbs for mental health, but I've narrowed them down to these 5 most important herbs for mental health: saffron, bacopa, rhodiola, kava, licorice, and St. John's wort. They reflect the range of purposes we need in mental health, such as we looked at in the previous slide. There's also good evidence for the use of these herbs. We can access these herbs. We can obtain good pharmaceutical quality grade doses and products out there in the market. And I'm going to explore these with you in depth. Saffron is your go-to herb as an antidepressant. It's pretty pricey. I encourage my clients to get some saffron threads and integrate it if they're making some vegetables or rice. You can also get a saffron formula, and sometimes saffron is mixed in capsules with other antidepressant herbs. Bacopa is another adaptogen, antidepressant, and very good for energy. I use it with people with PTSD. Rhodiola, I mentioned, supports tyrosine in the body. That means it supports focus, and it's also a mild stimulant. So when I have someone who's been self-stimulating with excess caffeine or energy drinks, I want to slowly help them detox from the effects of those drinks. And as they do that, I can add in a little bit of rhodiola in the afternoon. I've mentioned kava and licorice and St. John's wort as an antidepressant. What are the 5 most important herbs for physical well-being? And of course, our division between mental and physical is really an artificial one, but I want to break it down for you so that you can apply these in a variety of ways to help people symptomatically. Now, this speaks also to one of our major principles. Herbal medicine can support whole health. We need not have symptoms to benefit from herbal medicine. It can support our overall well-being. Herbal medicine can prevent us from getting ill. It can support immune function. It can keep our energy going when we're under stress. There's so many benefits. At the same time, we may find ourselves wanting to use herbal medicine to decrease symptoms that are problematic. Now, this is very similar to the principle of mental health. We want to get to the core issue of what's causing the symptoms, but we also want to help alleviate suffering as quickly as we can and reduce the symptoms that are so distressful to our clients. So keep in mind, when we're using herbal medicine, we're balancing out both bringing about overall balance and strength to the system, mind, body, and even spirit. But also we want to understand how herbs can reduce suffering immediately or in a few days' time. Turmeric is perhaps one of our most potent anti-inflammatory herbs. And recall that much of depression is rooted in inflammatory process, as is cognitive decline. I consider turmeric something that could be used daily. It's used in some of my chai recipes or my fruity turmeric smoothie recipe that I'm going to provide to you. Turmeric is something that can be incorporated into your food. You can take it in capsule form. You can take a mix of turmeric and glutamine for chronic intestinal problems. So there's a wide application of turmeric. And remember that in order for turmeric to be absorbed, it needs to be mixed with a little bit of fat and a little bit of black pepper. That's why however you ingest it, whether it's through making your own chai or buying chai or making a food, always add black pepper, add a little bit of coconut fat, and you'll absorb it into the system. So as you see, the science and art of herbal medicine is not just taking an herb, but knowing when to take it, what to combine it with, and how to get the best effects from that herb. Chamomile, I think, is one of our best known herbs. It's called manzanilla in Spanish. It's because it smells fruity like an apple. It means little apple in Spanish. Manzanilla is widely used. We have both a species that's endemic to the Western Hemisphere and also a European manzanilla. Both of them act as natural sedatives. They're very gentle and can be used with children and adults. Chamomile tea is used to settle an upset stomach. It might even be used as a poultice for a stomach ache. It's very soothing to drink a cup at night. I serve it routinely in my waiting room. It's a good starter herb for people to learn about. Now, the only contraindication is if someone has an allergy to chamomile, so it's important to inquire. Milk thistle is one of the most profound liver detoxifiers. And when we explore detoxification in a future module, I'll share with you some milk thistle recipes. If you're someone or you're working with someone in recovery from alcohol or drug abuse, if they are experiencing hepatitis C or any kind of liver cirrhosis, fatty liver disease of a non-alcoholic nature, just supporting the liver. Perhaps there's been a lot of exposure to chemicals for some reason. Milk thistle is a very widely researched resource for helping phase 2 detoxification in the liver. Basil, we all know that delicious pesto that we make with walnuts or other kinds of nuts and garlic and olive oil, that's medicine. And basil is also known as an immune booster and an anti-inflammatory. So eat lots of raw basil, cook it in your pesto, add it to your rice or to your vegetables, make it part of your daily or 3 times weekly menu. In Mexico, we grind up basil and add it to manteca or lard and apply it to an inflamed joint as well. So lots of traditional medicine to learn from traditional healers. And of course, cinnamon. A cup of cinnamon tea in the morning will reduce your blood glucose. So if you're finding that your mood labile, or if you're challenged with diabetes and depression co-occur commonly, cinnamon is a wonderful, delicious tea, and you can make it by just boiling up a little bit of root and straining it. You can also add cinnamon to some wonderful gluten-free muffins that you might make. Make cinnamon part of your daily routine. It's also very astringent, so it's very good for your intestines and your colon. Very good for helping you digest food too. It's very traditional to drink a cup of cinnamon tea in many cultures before you eat breakfast. So those are what I think are the 5 most important herbs for physical well-being. Now let's assess for herbal medicine use with our clients. And you see in this image, I've got both the raw plants. You'll see some chamomile and some lavender and some mint, but you also see pills and capsules. And any kind of treatment or intervention is going to be assessed for what's going to be isomorphic for adherence to a program. If a client tells me I don't like to swallow pills, then I'm not going to recommend they take pills or capsules. Maybe I'll find them some powder or some liquids. For example, when I'm working with someone who's in recovery from alcohol, who cannot take alcohol tincture or extract, then I'm not going to recommend an alcohol herbal extract for them. So this is, again, where our assessment comes in when we're talking with clients about what's going to work best for them. This will help inform some of the choices we help them to make. So what are some of the modes of herbal medicine delivery that are available to us? Teas, also called infusions. That's where we usually take a leaf, or it could be a seed or a root, and make a tea out of it. Capsules, tinctures or extracts. This is where the herb could be a leaf, but it's often a root, or seeds, or macerated, or they are sit in an extract, usually an alcohol, or it could be a glycerin, to extract the substances of that herb and then strained and used in dropper form. We might use herbal medicine in the form of baths, for example, sprinkling some lavender into our bath to help us relax and sleep, or making lavender pillows for sleep. Salves, which can reduce inflammation or pain. Syrups, we're so familiar with a honey licorice syrup, or the role of honey really as a wonderful antibacterial or even antifungal medium, which absorbs herbs and we can use for, let's say, a sore throat or an upset stomach. Poultices. Poultices are where we might apply an herbal formula to the skin. It might be part of a hot pack or a cold pack in order to penetrate into an area of discomfort. And then suppositories. There may be both anal or vaginal suppositories for treatment, and there are even many, many more. There are steams, for example. How often do we put a little eucalyptus into some steaming water and inhale that to open up the sinuses? So lots of ways to use herbs. I like to infuse smell in my office. I often will use a vanilla or a cinnamon or even a peppermint, which is very bright and enlivening, also very good for headaches. Herbs, or also called botanicals. I've mentioned gotu kola and its use for startle response in PTSD. Melissa, also called lemon balm. There's been some excellent research on the use of Melissa to reduce agitation in people with later stage dementia. And that research is exposing people to the aroma through aromatherapy of Melissa to help people calm down. Vervain, rosemary. Rosemary we often cook with, but rosemary is well known as an antidepressant, so sprinkle it on your potatoes. Ginkgo, I've mentioned. Ginkgo is well known and well studied for enhancing blood flow in the brain, and it's generally part of many cognitive health formula that you'll find in herbal medicine. Hypericum is the Latin name for St. John's wort, and what you'll see here are both the common names and the Latin names. Wild oats. We all know the calming effect of oats and oatmeal. You can get a wild oat tea or a wild oat tincture to help you relax. Damiana, a well-known Chinese herbal medicine used to support women's health and energy. Kola and Siberian ginseng, both used for energizing and coping with the stress of modern life. Let's look at nervines, and you can hear in the name nervine, nerve. Nervines are herbs that help calm down nerves and the nervous system. These are considered the botanical equivalent to pharmaceutical sedatives. So when you're thinking about needing a sedative, this is where you consider what are called botanical nervines. The benefits are that unlike many pharmaceutical sedatives, they do not suppress a rapid eye movement phase of sleep, as many pharmaceutical sedatives do. And nervines are not habit forming. So what are some botanical nervines? Avena sativa, oats, gotu kola, also called pennywort, black cohosh, and you're familiar with black cohosh because we use it also for menopause, Siberian ginseng, California poppy, and ginkgo biloba, also called maidenhair tree. Adaptogens are another major category that we should explore for mental health. Again, these help our body adapt to stress by restoring the biological capacity to cope and respond. They're also called metabolic regulators because they help us adapt to environmental stressors. Rhodiola, gotu kola, ashwagandha, Siberian ginseng, schizandra, and licorice root. And at the bottom of this slide, you'll see that I've given you a recipe for my fruity turmeric adaptogen smoothie. And this is a smoothie designed to give you adaptogenic response using herbs and fruits and foods. Let's look a little bit more about the benefits of licorice root and what is known. I mentioned that it's considered one of the preeminent herbal medicines. It's anti-inflammatory, it's an expectorant, which is why we see it in a lot of throat remedies. It's demulcent. That means that it's very soothing to the mucous membranes, and it's been shown in the lab to be antiviral. It's used, for example, to suppress chronic viruses such as the herpes virus. So anyone who is dealing with the herpes virus benefits from taking licorice as a tea or a capsule. We also use licorice in gel form for herpetic lesions that arise from herpes zoster, the shingles virus, and you can work with your compounding pharmacist to use herpes for this treatment for herpes. The minerals found in licorice root suggest that it's very stimulating, so that licorice does not relax you, but indeed part of why it works as an adaptogen is that it supports your cortisol function, your adrenal function. It's very rich in sodium, potassium, iron, and manganese. The reason why one wants to be careful and not use licorice root excessively is because of the sodium content, which causes fluid retention. Now, you heard me mention that you can chew on a licorice stick and cross the desert and retain your fluid in the process. But it's for just that reason that if you have high blood pressure or edema or are challenged with these kinds of fluid retention, you want to moderate your licorice intake. I want to share with you one of the best recipes that comes out of Ayurvedic medicine. It's called polarity tea. And this is the recipe: licorice root, fennel seed, fenugreek seed, and flax. What I recommend is that you go to your local herb store and collect these dried pieces in this ratio, and you can mix them all together. Again, they're dry, and you'll end up with 5 ounces of this herbal compound. Store it in a jar in a dark place, and then take a tablespoon of this mixture and add it to 2 cups of simmering water. Now, one of the principles of herbal medicine preparation is that you infuse a leaf, meaning you don't boil it. You boil the water and then you add the tea leaf or any kind of leaf to the water and let it sit. But in order to extract the benefits of roots or seeds, you want to gently simmer. And as you gently simmer, you see here this beautiful golden yellow that will emerge. After about 15 minutes of simmering this mixture, you can strain it. Now, not everyone loves the taste of licorice. If you don't, there'll be another herbal adaptogen for you. This isn't for you, but if you like the taste of licorice, it's so soothing, it's mucilaginous. I make this for my kids if they've got a sore throat, an upset stomach. If I'm under a lot of stress, I'll have a cup a day for the week of that stress if I've got to do something out of the ordinary. It's also a wonderful cleanser for the liver. And so experiment and enjoy this delicious Ayurvedic adaptogen tea. One of the other benefits of licorice is that it supports cortisol. And the main effects of cortisol is that it's anti-inflammatory. It prevents elevation of blood sugar, but excess cortisol suppresses immune function. And the glycyrrhizic action in licorice inhibits the breakdown of cortisol, and it supports the naturally produced cortisol. And so this is the understanding of why licorice root is so good for chronic stress and adrenal function. And really remember that anybody with chronic mental illness really begins with chronic stress. So you can't go wrong supporting the body, mind with an adaptogen like licorice. Flax is another important component of polarity tea. It's a good source of essential fatty acids, it's anti-inflammatory, and it's demulcent. And we often use flax. We'll grind flax and we'll add it to cold water. It thickens up, and then we drink it down. It's very good for the intestines, very good source of essential fatty acids. But remember I mentioned poultices. We'll often use flax seed ground up as the basis for a poultice. For example, for bronchitis, where we might grind up flax and add a little bit of ground up mustard to it. And this is an old-time recipe, and you apply oil to the chest, and then you mix up a little bit of that ground mustard seed with a lot of flax, and you apply a paste to the chest, and you cover the chest and apply a hot water bottle, and that heat helps sink in the effects of the mustard seed, and it brings oxygenation through blood flow into someone with bronchial congestion. So remember the various roles of flaxseed in your medicine cabinet for your herbal medicine repertoire. Fennel seed. We've had plenty of fennel after a good Indian meal because it's a carminative. It reduces gas in the body. It helps us digest. It also is known to relieve anxiety. The essential oil of fennel is very helpful in treating depressed mood. I'll often boil up fennel to infuse the air with a delicious aroma of fennel when I know I'm going to see a number of depressed clients that day at the office. You can, of course, use it in cooking. There's wonderful recipes that use fennel. And you can make it just into a very simple tea for your digestion, or just chew on a few seeds after a meal, and it's a good breath freshener as well. Fenugreek also reinforces the mucilaginous or soothing qualities of the polarity tea. It aids digestion, it's cleansing, it helps purify waste in the body. It's a good source of L-tryptophan, which is an antidepressant, aids in sleep. And again, you can make a tea out of fenugreek or use it in a poultice. So these are the ingredients that go into making polarity tea. Eleuthero, a very well-studied plant. It increases the ability for physical and mental stamina. It supports energy, and it's well known as an antioxidant. And remember, one of the core principles of mental health nutrition is antioxidants, countering the effects of oxidation and the effects of that on mental health. So Eleuthero is a wonderful plant that you can get in tincture extract form. Amrit guduchi, a well-studied plant from India, also called heart-leaved moon seed. Look at the beautiful plant and berries. The Indians consider the Amrit guduchi the ambrosia of immortality. So important is Amrit guduchi as an adaptogen and to provide strength. It's best used when combined with ghee or fat with a meal, and you can combine it with ashwagandha for anti-stress. So that's a nice little compound to explore. And I think that's the best way to dip your toes into herbal medicine, besides doing a foot bath, is to explore one or two herbs that strike your fancy or that have an effect that you want to explore for yourself, or read more about, or study about, or maybe your grandmother or grandfather or great-grandfather or grandmother used it in your own family. Let's talk about the three sisters of sleep, as I call them: passion flower, valerian, and hops. VHP is often a compound that you can buy already prepared, or you might gather these plants together and infuse a tea for yourself. I call them the three sisters of sleep because when combined, they help us sleep. They're a very gentle sleep aid, and so many people these days suffer from poor sleep. I usually suggest that people buy a compound called VHP, valerian hops and passion flower. Hops is a digestive aid. As I mentioned, it's an appetite stimulant. It's part of the cannabis species. It's a pain reliever. It helps for insomnia, anxiety, restlessness, nervous tension, and stress. It's also mildly estrogenic. So excess use of hops, for example, it's rare that someone drinks too much hops tea, but where do they get hops? They get it in beer. And so that's where you see the beer bellies in men drinking too much hops. So it's mildly estrogenic, which makes it wonderful for perimenopause and premenopausal women and menopausal women. I just wouldn't overdo it, men. But enjoy your valerian hops and passion flower because each of these herbs synergize each other. And this is another principle of herbal medicine for mental health. Sometimes one herb with a quality isn't enough, but two or three work together to synergize and optimize the effects that we're seeking. And in this case, valerian hops and passion flower are very gentle, no hangover support for reducing insomnia. I mentioned skullcap a little earlier. It strengthens and supports the nervous system. There's good evidence for its use in migraines, depression, insomnia, ADHD, and neuralgia. It's been used for epilepsy, inflammatory process, muscular spasms, nerve pain, and vascular disorders. I emphasize its use in anxious depression associated with disrupted sleep. So let's talk about how we put this together for stress and PTSD. I like to choose herbs that have multiple effects. And if we break down some of the sequelae of PTSD, oftentimes people are anxious, they're exhausted, they're stressed out, they're depressed, maybe their digestion is disrupted, they may or may not have pain, they could have heart problems, they might have liver problems if they've been self-medicating, they may need more help sleeping, and of course they may have problems with their immune function because chronic stress reduces immune function. So you see what I put here along the left-hand list are the variety of herbs associated with these actions. Nervines for the nervous system, adaptogens, antidepressants, digestive aids, analgesics, cardiac tonic, hepatic, hypnotics, and immune support. And what you'll see here in red is identifying some of the herbs that have multiple effects. We don't want to suggest that someone takes 10 or 15 herbs. We might use herbs in cooking, but then we might have some medicinal formula that people can take every day or during the day and others at night. But we don't want to overwhelm our clients, and yet we want to optimize the effect. So look at passion flower. Passion flower is a nervine, but it's also an analgesic, and it's a hypnotic. So it relaxes, it reduces stress, it helps reduce pain, and it also induces sleep. So I may go with passion flower because it covers 3 areas that I'm trying to affect. How about skullcap? Skullcap, again, is a nervine, and we also find that it's a hypnotic. How about gotu kola? I might choose gotu kola with my client who has a startle response, and so on. And you can see hops. Now let's look at some of these other herbal effects. For example, antidepressants. Coffee is a gentle antidepressant. Digestive aids, cardamom, dill, cumin, caraway. These are all seeds that can be cooked with that are helpful for enhancing digestion. Analgesics, chamomile's a mild pain reliever, hops, passion flower, and valerian. A cardiac tonic, let's say I'm working with someone with PTSD, he's not sleeping well, he's anxious, we've got some passion flower for him, but he also has heart problems from chronic autonomic hyperactivity. And so he may benefit from hawthorn, our preeminent herbal medicine for the heart. Hepatic, what about someone with PTSD who's in recovery from alcohol use? I want to identify dandelions, and you remember from our culinary medicine module the use of fresh dandelion, but if you don't have fresh, you can get dried dandelion and make a dandelion tea, or you might use fennel in your cooking. Golden seal is very good for the liver, but it's to be used only short term, not every day. And of course, milk thistles, I mentioned. Hypnotics, I think most clients these days benefit from sleep aids, hops, passion flower, skullcap, and valerian. And then of course, immune support like amrit, kuduchi. Let's look next at herbs with antidepressant evidence. Saffron, both the stigma and the petal, were found in research to be more effective than placebo and equal to the effects of fluoxetine and imipramine in a clinical study. Lavender was less effective than imipramine, but the combination of lavender and imipramine was more effective than imipramine alone. And there's a wonderful new product out on the market that is something that is top at my list. It's a lavender extract called Lavella. Very good anxiolytic, very good nervine, helps sleep. So put Lavella at the top of your list. Yes, lavender petals are wonderful, the smell, the essential oils, but to get a good medical effect of lavender, go look and research Lavella, L-E-V-A-L-A. Rhodiola, I'll repeat over and over again, is an antidepressant, and St. John's wort. The research with St. John's wort was conducted where it was standardized as an extract to contain a certain amount of hypericin, what's been identified as an active substance, perhaps the major active substance. And this is, of course, often how clinical research is conducted or laboratory research is conducted, is standardizing the dose that's delivered. Otherwise, we have no way of knowing what is having an effect and how much is required to have an effect. And so in many ways, the work that's been done in herbal medicine is the same as work that's done on all pharmaceutical medications. And indeed, some pharmaceutical medications are actually derived from extracts obtained from herbal medications. Now, it's important if you're going to use St. John's wort to realize that it can produce what's called photosensitivity. That means if you're using St. John's wort, you want to minimize your exposure to the sun, or just be aware of that because it can cause a kind of dermatitis if you're using a lot of it. Rhodiola is an adaptogen and an antidepressant. I use it in depressive syndromes, where there's mental and physical fatigue, and also for memory loss and cognitive dysfunction. Use it where there's fatigue, depression, where you want to improve productivity, increase attention span, memory, in work. I get a lot of people off of these pharmaceuticals that they're using unprescribed for productivity, and try to exchange out those medications for rhodiola. That's how I would use that. There are very few side effects for rhodiola. It's been shown to improve mood, energy, mental clarity. If you use too much of it, it can make you feel jittery, just like drinking too much coffee can. I recommend taking it earlier in the day. It can interfere with sleep, again, like coffee, if you use too much of it. It can also cause vivid dreams. So start slowly, like any intervention, and see how you adapt to it. People with bipolar disorder who may be vulnerable to becoming manic when given antidepressants or stimulants should again begin with low dose, maybe a cup of rhodiola tea, for several days, and see how you respond to it. And I've provided on this slide rhodiola dosages, 5 to 10 drops, 2 to 3 times a day, about 15 to 30 minutes before eating, and try that for a period of 10 to 20 days. Now, if you're experiencing severe distress, you can increase that dose to 10 drops 2 to 3 times a day, and you can increase it to 30 to 40 drops. The principle for dosing is always begin at a low dose, see how you respond, because many people have very positive responses to what we call subclinical doses. As a general rule, you'll find dosing in the literature, and you'll find it on tinctures and bottles. But you'll also want to explore both these resources I provided you and also the scientific literature to understand further appropriate dosing. Next, we're going to talk about medical cannabis. There are a number of roles for medical cannabis in both physical and mental health. Let's explore that a little bit. For cannabis is perhaps one of our preeminent herbal medicines. Cannabis is found to be antispasmodic, meaning it reduces spasms. It's antiemetic, meaning it reduces regurgitation and nausea. And it's very good for the treatment of pain. We know that THC, one of the major psychoactive components of cannabis, targets the memory receptors in the brain. This may explain why many people with PTSD who want to forget the trauma they've experienced use a lot of cannabis. Cannabis relaxes the arteries and it relieves migraines, which is often due to low serotonin levels. In Mexico, for example, traditional healers make a liniment out of cannabis for massaging painful joints. So cannabis is used in many variety of ways, both as an edible, it can be smoked, it can be applied topically to the skin, can be used as a tincture under the tongue. Cannabis has been found to be what's called a COX-2 inhibitor. That is an inflammatory enzyme that is reduced, which is why cannabis is used as a natural approach to treating osteoarthritis pain. The question of whether cannabis contributes to the progression to psychosis in young people is unresolved. I think that there is literature on both sides, As a general rule, cannabis use, unless you're looking at epilepsy in children, is probably left best unused until the nervous system and the brain is fully developed. However, that's easy to say. Most people start experimenting with cannabis when they do begin at a young age. The question is whether it's the THC, which is the psychoactive aspect of cannabis, it contributes to psychotic symptoms. There's some evidence by Morgan and Curran that smoking strains of CBD and THC may be protective against the psychotic-like symptoms of THC alone. And so if you do have a client who's using cannabis for recreational purposes, I think that we can educate clients or find an expert to educate the client about using some strains where there's less THC to reduce the potential for those psychoactive symptoms that could lead to psychotic experience. But as I say, the research remains unresolved. High CBD content of medical cannabis is an alternative for 1/3 of the people who do not respond to conventional antipsychotic medication. Those of you who work with people with psychotic disorders know that people often with psychotic disorders gravitate towards cannabis with mixed results. Again, this is where the research by Robson, Guy, and DeMarso suggests that if you can use a strain that's high in CBD, which is non-psychoactive and targets the CBD receptors in the brain, that's very relaxing, then that might be an alternative. And indeed, I suspect that the gravitation towards cannabis for this effect is why people with psychotic disorder are using cannabis. So the ability to ensure medical quality CBD-rich strain would probably enhance the effects for people. And the research by these scientists suggests that this would be an alternative for people who are non-responders. And indeed, we know that many people don't respond to the antipsychotic medications, and they're very difficult on the body and the mind, which is what then leads to non-compliance. So this is something to explore further if you're working particularly with the psychotic disorders. Cannabis has been shown to increase serotonin and dopamine levels. Research shows that in low doses it's beneficial for depression, but in high doses it can increase depression. People benefit from cannabis use who have inflammatory bowel disease, and I think this again speaks to the whole issue of the endocannabinoid receptors that are found throughout the body. Research with the phytocannabinoids shows that it reduces and reverses intestinal permeability associated with inflammation. And we explored intestinal permeability earlier in the digestion module and how that leads to chronic neurological and digestive problems and mood disorders. Cannabis has been shown to have a beneficial effect on diabetes type 2, it lowers insulin levels. Essential fatty acids positively affect the endocannabinoid system in the brain, reinforcing supplementation for people who wish to decrease or eliminate recreational cannabis use. So when I'm working with someone that wants to decrease cannabis use, I increase fish oil. Hemp oil is a good fat to increase along with the fish oil, borage oil, and butter. Now, THC has been found by Eubanks and researchers to be beneficial in the treatment of Alzheimer's disease. It has been found to inhibit the enzyme acetylcholinesterase and prevents the plaque buildup in the brain. And there's significant evidence that supports its use as an antidepressant, as an anxiolytic. Now, we all know that cannabis can increase anxiety in people too, or increase sleeplessness. So again, this goes back to not using just any strain of cannabis, but to doing research like we would with any kind of intervention to identify the appropriate strain to address the overall health and the required symptoms and the personal reactive response to a particular strain. Very exciting research shows that states that have approved the use of medical cannabis have seen a significant reduction in deaths due to opiate use. This has been found particularly in the states of Oregon and Washington, and I provided the reference for you here for your further research. We know that cannabis is widely used to self-medicate by people with chronic pain, neurological disease, with PTSD, and in schizophrenia. So again, contraindications: under 18, use with caution, but certainly emphasize CBD-rich strains if using cannabis under 18. There's some excellent research, I won't go into it here, but you can certainly find it in the literature about using CBD in intractable epilepsy. And work with a specialist, work with someone that's going to support your building your knowledge base if you're living in a state where there's either medical or recreational cannabis. Let's look here at the cannabinoid receptors. These receptors are found throughout the body, and they're divided into two main subtypes. One's known as CB1 and CB2. CB1 is found mostly in the brain. CB2 are found all throughout the immune system. There are 113 different cannabinoids, THC and CBD. THC is psychoactive, and you see here on the left the CB1 receptor. And the common effects of the CB1 receptor target include euphoria, relaxation, anxiety, and short-term memory impairment. And the CB1 receptor for THC, for CBD, is it decreases negative side effects of THC. So you see how CBD balances out the psychoactive nature of THC. And it decreases anxiety, and it decreases short-term memory impairment. Personally, in my own practice, I really emphasize the use of CBD oil, which currently remains legal in the United States. CBD and TBI. We found through research by Sherman and Lichtman that CBD increases brain levels of endocannabinoids during a traumatic brain event. So the theory is that CBD has a protective effect in the brain, it's a potent antioxidant, and that it promotes neurogenesis in the hippocampus. So this is what's been found to occur in response to traumatic brain injury. Endocannabinoid deficiency syndrome. This is a term that was coined by the neurologist, Dr. Ethan Russo. Dr. Russo's hypothesis is that all humans have an underlying endocannabinoid tone. This is a reflection of levels of endocannabinoids in the brain and the body, and this includes how much we produce, our metabolism, and the state of our receptors. Now, some of this is going to be congenital and some of it's acquired, but it all leads to what's called endocannabinoid tone, and a reduction in endocannabinoid tone contributes to pathophysiological syndromes. Dr. Russo in endocannabinoid deficiency syndrome has studied quite a bit the effects of cannabis on the treatment of migraines. His evidence for ECD, we'll call it for short, include migraines. Cannabis was a mainstay migraine treatment between 1843 and 1943 in the United States. We see fibromyalgia, IBS, inflammatory bowel syndrome, PTSD, bipolar, as a hypothesis of endocannabinoid syndrome. And advanced imaging has shown endocannabinoid hypofunction in PTSD. And I provided you the research here at the bottom of this slide. So there's a little bit of an introduction to the use of medical cannabis and what's known about it. There's extensive books, research, and writing going on as we speak on endocannabinoid deficiency syndrome and the use of cannabis. In my own clinical practice, I think it's a very good alternative for chronic pain and anxiety, sleep dysfunction associated with PTSD. But as I say, my preference is the use of CBD-rich strains, non-psychoactive THC. Let's talk a little bit more as we delve into psychoactive herbs. Here you see the psychoactive herb iboga. Iboga is an herb, it's a plant that comes out of West Africa. It's used in the Bwiti religion as a psychoactive euphoriant. The extract is called ibogaine, and it's used in particular for the treatment of opiate addictions. It's a powerful contact receptor for the opiate receptors in the brain. Now, other plants that we could consider psychoactive include kava, salvia, even coffee is a psychoactive, and then entheogens, I'll explore in a future module. Ginkgo biloba. Ginkgo biloba is widely used to prevent cognitive decline, and it's standardized to contain 24% ginkgo flavingoglycosides, which can be effective for depression and cerebrovascular insufficiency. We have cerebrovascular insufficiency in chronic inflammatory process, in atherosclerosis, in cognitive decline, in vascular dementia. And so think about ginkgo when you're thinking about cognitive health and increasing blood flow in the brain. It has been found to act on the hypothalamus, and in one animal study, it was found to exert both an anxiolytic and antidepressant activity. Now, one caution is that I've worked with ginkgo quite extensively with clients, and very occasionally sensitive clients can get a headache from using ginkgo. And so just be aware that this could be a very rare side effect, and in which case I might find another herb or nutrient to use with that client. Lemongrass. We all enjoy delicious foods made with lemongrass. It's used in Brazilian folk medicine as an anti-anxiety. We use it in cooking. It's an essential oil. Go to your local grocery store and get some fresh lemongrass root, boil it up, or add it to coconut milk or coconut fat and make a delicious food out of it or a tea out of it, or as you boil it up, even as an essential oil wafting in the air will bring a delicious smell, and it'll decrease anxiety in your office waiting room. I mentioned bacopa earlier. This is also known as water hyssop. This is perhaps our preeminent herb for cognitive support. It enhances memory recall, and this has been found to enhance memory at a dose of 300 to 450 milligrams per day. Now let's take a moment to look at indications and contraindications. What do we need to be concerned about when using herbs? Let's remember to check our herb and drug interactions. Many of our clients are on medicines for physical health or mental health. They may be self-medicating. We've gathered all of this information in our early assessment. Now let's put it together as we're exploring what's going to be beneficial for them. We know that the power of herbal medicine works because it has the potential to interfere with drugs that people are using as well. It has powerful effects. Now, these effects can be used to either synergize, allowing you to reduce pharmaceutical use, you can eliminate pharmaceutical use, or you may not be able to use certain herbs because it will interact negatively with pharmaceutical use. So keep this in mind as you're exploring herb use with these herb drug nutrient databases that you have at your fingertips. So what are some of the common interactions? People might have a synergistic effect. For example, if they're using St. John's wort, maybe they're going to get a little bit too much of an SSRI effect. May allow them to reduce their SSRI. This is where, of course, you'd want to work with the prescriber. You're going to get neurotransmitter responses to many of these herbs. If you're using something internally or externally, there's an occasional allergic or dermatologic response that can occur. We've talked a little bit about toxins or contamination of herbs, therefore making sure you know where your source is coming from. And then know that there can be some interactions with liver detoxifying enzymes. For example, that's why you don't want to use golden seal excessively. Again, know your herb and know how often it can be used and in what dosage. We should take these as seriously as any other intervention that we need to be knowledgeable about. For example, someone might use golden seal if they are sick, but maybe you might use it for 5 days. You don't use it for 55 days. Someone might use oregano, oil of oregano, if they're having some kind of intestinal problems. But that's not to be used every day. It's to be used for short term, much as you would use an antibiotic. Indeed, oil of oregano is considered an herbal antibiotic. But again, there may be times when you need a pharmaceutical antibiotic. And so these are the kinds of questions that we're going to be exploring as we think about herbal medicine and its application. Let's now discuss essential oils and aromatherapy. Essential oils and aromatherapy works via smell affecting mood, physiology, and behavior. Aromatherapy has been found to have a mild anxiolytic effect. For example, in PTSD, it's been found to reduce anxiety and enhance sleep. This is work that was done in Europe. Peppermint, for example, quite the opposite, is used to enhance, wake up, increase alertness. Peppermint's also a wonderful herb for headaches. And then ylang ylang significantly increased calmness. And so this is where I work with my clients to identify herbs or smells that they gravitate to. And I ask them to come in with one or identify one, and we can research together, identify how to use it, and explore how it makes them feel. Or I might have a different one in my office every week, infusing the air, and people may say, "Oh, I love that smell, what is it?" And I can take that opportunity to educate them about using smell to change their mood and enhance their well-being. Essential oils are called volatile oils. They're the fragrant essence in plant. And the practice and use of aromatherapy is not subject to approval by the USDA, Food and Drug Administration. So you are free to apply aromatherapy, and there is a well-developed science of aromatherapy. The theory of aromatherapy is the binding of chemical components in essential oil to the receptors in the olfactory bulb, stimulate the brain's emotional center and the limbic system. So how do we use aromatherapy? What are the modes of application? Let's just take one, for example, the topical application of tea tree oil. It's a potent antibacterial, it's an anti-inflammatory, and it's also analgesic, meaning it reduces pain. I use a solution of tea tree oil to disinfect my office. I don't use harsh chemicals, which are excitotoxins. I'll use tea tree oil, and then it leaves a very lovely smell. We have modes of application that include what are called carrier oils. These dilute the essential oil for application to the skin. So for example, almond oil or coconut oil may be what carry it, and you might add a few drops of the essential oil to that. What this does is it prevents the essential oil from causing any problems on the skin, and it allows you to lubricate the skin with something like almond or coconut, or maybe even sesame, a light sesame oil, and still get the benefits of the aroma. What's been found through research is that there's occasional dermatitis that can occur if you apply essential oils directly to the skin. That's why we add it to the carrier oil instead. Lavender, peppermint, tea tree oil, and ylang ylang are among those that are identified as most prevalent for causing dermatitis reactions. You can also do what's called aerial diffusion. That's where you have a steamer or a way to perhaps a few drops or in a ceramic bowl, and you have a fire underneath it, a little candle to diffuse it into the air. And then of course you've got direct inhalation. You might just put a little bit on your hands and inhale it when you want to boost. I think it's great for clinicians. I do this after each client just to clear the air and re-energize and get ready for my next client. Eucalyptus, I mentioned earlier, you can add to a boiling pot of water and put a towel over your head and inhale it if you've got congestion or fighting a cold. So lots of ways to explore how you'd like to apply and use essential oils. You remember in our culinary module I talked about citrus, and we know that citrus is an antidepressant, and just opening up a lemon or a lime or an orange and inhaling it can improve your mood. Let's talk about the power of smell and taste on memory. Think now back to some of your most pleasant holiday experiences. Cinnamon, vanilla, baked goods were those smells about the holiday. Just being able to think about what your family made may bring about positive responses. On the other hand, if the holidays and those smells were not associated with positive responses, they can bring you down. So right now, think about the delicious smells from your childhood. Now, think about an offensive smell or a trigger smell. What really sets you off? And now, close your eyes and think about a lemon. Open up that lemon, hold it up to your nose and inhale it. Just think about that. Are you starting to salivate? Just thinking about a lemon causes a neurological and physiological response. Smell alters consciousness, as you just saw. Loss of smell and failure to differentiate smells, particularly peppermint, fish, orange, rose, and leather, have been studied as a possible indicator of risk of dementia. Loss of smell is linked to earlier mortality. The importance of the nasal biome is playing a more important role every day in understanding our own microbiome. It's not just the gut and the second brain and our skin biome, but our nasal biome has been found to be essential to maintaining cognitive function and mental well-being. Dr. Bredesen has identified a new type of inhalational Alzheimer's due to mold. This speaks to some of the approaches that we'll explore in the detox module, where I introduce you to the use of the neti pot or saline sprays to maintain health of the nasal biome. And we'll talk about the nasal biome more too when we explore pranayama and breathing in yoga. We know that odors produce specific effects on neuropsychological and autonomic function. They influence mood, perceived health, and arousal. Lemon oil in research has found reliable results to improve a positive mood. And lavender has been found consistently to reduce autonomic arousal. Mood booster. Smell an orange or a lime. Rose water, which is used commonly in the Middle East and in Indian cuisine. What does the smell of a rose lift our mood, opens the heart? And roses and rose therapies are used in religious rituals among Muslims and Hindus. Sleep and headaches. I mentioned lavender earlier. I think this could be one of your first go-to herbs to work with. It's been shown to have positive effects on mild sleep problems. And lavella, which is an essential oil extract called silexan, has been studied extensively. It's indicated for anxiety, it promotes relaxation, and it calms nerves. I provided you the research at the bottom of the slide. Melissa officinalis, lemon balm, has been used with dementia agitation. It's been found to be a safe and effective treatment for the management of agitation in severe dementia. And as we near the end of our training and we put together all of these interventions into a protocol, I'm going to share with you how to integrate light therapy for sundowning, certain foods and smoothies for people with dementia, for cognitive health and relaxation, the use of essential oils, the use of herbs, the use of touch therapy, so that you can explore an integrated approach to managing dementia agitation. Herbal medicine resources. These are a few of the resources that I think you'll find very helpful. There's an AZ guide to drug-herb-vitamin interactions. This is put together by Dr. Alan Gaby, a physician who's also an herbal and nutritional expert. The American Botanical Council is a wonderful organization. I encourage you to explore what they offer. You can join and get access to the latest research. And then again, the Registered Herbal Therapists of the American Herbalist Guild is where you can find well-trained herbalists as well, all throughout the country. In summary, we have reviewed the ethical and practice issues of herbal medicine for mental health. We've identified some specific actions of herbal medicines. We've discussed different classes of herbal medicines, methods of ingestion and preparation, the application of herbs to support whole health and to decrease symptoms, the role of cannabis, in particular, and endocannabinoid deficit theory of Dr. Ethan Russo. We've discussed exploring herb-drug, and I'll add nutrient interactions through the databases I've shared with you, and then the role of essential oils and aromatherapy in our clinical practice and for client use at home. Thank you very much.